Welcome to Public Health Matters, where we talk about matters of public health. I'm Bobbie Bagley, Chief Public Health Official and Director for the Division of Public Health and Community Services. And I have with me today Sheila Kimani, who is the Director of Business Development at Guardian Home Care of New Hampshire. And I'm just going to read a little bit of your bio because this is really impressive, and I am very excited about the work that you're bringing to New Hampshire. So Ms. Kimani combines her extensive experience with a deep commitment to compassionate care, with a background as a case manager for the Choices for Independence, which is CFI. We all know that very affectionately as CFI. Yes. She brings her valuable expertise in supporting clients, family caregivers, and case management and partners. Now, your journey in home care began as a personal care assistant yourself and working as a home health aide. And in these roles, it gave you firsthand understanding of the critical importance of providing personalized, empathetic care in the home setting. So I'm going to stop right there because I want you to talk more about the other information that's in your bio, yes, but to also share with us why you decided to get into this work.
Okay, well, thank you so much for having me. I'm excited to be here. My name is Sheila, and I have had this passion to be in the home care industry ever since when I was a PCA. When I was a PCA, I used to go out there in a retirement community and take care of people, do personal care, do meal prep for them, do housekeeping and everything just to help them be comfortable. Mm-hmm. And we know most of the elderly people, they just want to live comfortably at the at the end of their life. So I helped them do that. And when I was doing that, I was like, I wonder if there's a way I could make impact to more people. And that's how I came across the case management role, where I was a CFI case manager. I never knew about the program before. Okay. But when I read about it, I'm like, oh my goodness. So there's a program out there that can help people stay at home in their own homes and not have to go to a nursing home and just receive the services at home. They can receive home care services, like they can have a PCA go out there and just take care of them. Mm-hmm. They can have meals delivered to them. They can have any equipment that they want at the comfort of their home, of their own home.
Right.
They can also get like bathroom modifications and home modifications, and that's something that most people did not know about. So I was very excited in my role as a case manager, and I got to help. I used to have a caseload of 40 clients at a go. And when I was doing that, I really was like, I need to help people as much as I can.
Right.
And I did that. So with the new role as a director of business development, I get to see, a close-up when we are offering the PCA services. So with Guardian Home Care of New Hampshire, we do offer PCA services, we do offer nursing services, and most importantly, we do offer the family caregiver, which is covered by the CFI program. This is where someone can get paid to take care of their loved one at home. Mm-hmm. It could be a family member, it could be a neighbor, it could be a friend, whoever is at home and they need your help, or rather you're helping them already, would help you get paid to take care of them. So I have been passionate about especially that program because people out there are quitting their jobs and just staying at home and not receiving any kind of support. Mm-hmm. So we are here to support them and just make sure that they get reimbursed for that.
Yeah, that's a great program. And I'm sure, as you mentioned, Sheila, there are probably plenty of people who are at home right now, mm-hmm, taking care of either an aging adult, senior, or they may be at home with a family member that may have a disability. And they don't mm-hmm know that through your program, they could actually get a monetary mm-hmm financial support for doing that with their family members. Yeah. Now, how would a person sign up for that? What do they have to do?
So first of all, we have to check if the loved one, if the person is eligible for CFI, which is under Medicaid. If they're enrolled under Medicaid, they would qualify. That would like step one into qualifying for the CFI program. Okay. They have to meet the income limit requirements, and they also have to meet the medical eligibility requirement. They have to have a medical condition that makes them eligible for the program. Okay. Because the state will go out there and do like a medical eligibility, send out a nurse and say, okay, this person is qualified for CFI or this person is not qualified for CFI. they have to at least need 2 to 3 help, like they must require some help with IADLs, which is activities of daily living,
Okay.
or instrumental activities of daily living, which is help with meal prep, laundry, personal care, transfers, or even just running errands. Some of them cannot go out to do their grocery shopping.
Right.
So if they are able to qualify medically and through financial eligibility as well, that helps them enroll into the program. And once they enroll, we get to hire the person that's already taking care of them. So we'll just need this person to be 18 years of age and be taking care of that of the loved one. We would just have them sign up, do the job application at our company. They go through training. They go through. We support them in the best possible the way that we can,
Right.
and we pay them for the orientation that they come to do at their offices. We'll pay them for that. We pay them for the training that we are providing them as well. And our rates are very competitive, and we also give them full benefits. So we're talking health insurance, dental, vision, 401k, all that, PTO, sick time accrual. So we treat it like a job. Like, yes, you're taking care of your parent at home. You've been doing it for years.
Right, right.
But if you just get the monitoring, get the support that you can, because everybody has their own need
Right,
for money.
right.
There's things that need to be paid for. There's things that bills come up and you're like, I don't know how to pay for this bill because I don't have money, or I don't know how to even support myself. So we try to recognize that, and we also have we have the support because we have our own staff, our own PCAs and LNAs and nurses, that they would offer the support to them if in case they go facing like a caregiver burnout.
Right,
Because
right.
that's something else that comes up. Would be able to step in and be like, okay, you take 2 weeks off, and we'll have someone go out there and help your mom or help your grandma in whatever possible way.
Right.
Yeah.
Yeah. And it's this, the CFI, or the Choices for Independence, is a really good program because
Yes.
it allows for individuals to stay in their homes longer.
Yes, in their homes longer.
Right.
And that's the goal. That's the goal of the program. Choices for Independence. It's you live in your own home independently
Right.
without going into a nursing home or long-term
And
care.
that can help save quite a bit of money because not everyone can afford
No.
the nursing home or long-term care facility costs.
No.
So this program that you're supporting through Guardian Home Care allows for families to have an alternative.
Yes.
And to have a safe alternative, because a caregiver, either from your agency
Yes.
or an individual that can stay at home with their parent,
Yeah.
can receive financial or monetary benefit to support that.
To support that, absolutely. And I know going into the holidays, a lot of people are going to be coming at home and they're like, oh my God, I don't know what mom needs the help or grandma needs the help. How do we best support them? So
Right.
Guardian is here. Guardian Home Care would help set up the services for you. If they're enrolled on Medicaid, we'll help see if they're qualified for CFI, and work with them to just make sure they're able to get enrolled into the program. So we're here to help. We're here to keep people at home in their own comfort, and just treat them with all dignity and respect as we can.
Nice, nice.
Yeah.
So Sheila, tell us a little bit about the origins of Guardians of Home Care of New Hampshire. So this is a new business
Yes.
that's come in and actually has acquired the services that were provided out of which we used to call Harbor Homes,
Yes.
which is now Harbor Care.
Harbor Care,
But they used to have the Healthy at Homes program
They
that
did.
now has transitioned to new ownership
Yes.
with you at Guardian Home Care
Care.
of New Hampshire.
Yeah, absolutely. So back in May, we were able to acquire Healthy at Home, which was part of Harbor Care, was the home care agency. We were able to acquire them, and so the transition happened in May. We were working behind the scenes and trying to get everything situated back. It started all the way back in January, just trying to go through the whole acquisition process. But we officially transitioned from Healthy at Home to Guardian Home Care back in May. So all the patients that were under Healthy at Home were started receiving services with Guardian Home Care. I think it was May 31st. So it was an exciting day that we were like, okay, now the patients are under us, and now we're up and running and ready to provide the services for our patients. We did transition with at least 60 patients and 23 staff members. Right now, we are at 100 patients and 63 staff members. So I would say we're growing, and we're here to support the people of New Hampshire. Back, Healthy at Home was able to do around six towns, which is Nashua, Amherst, Milford, Hudson, just the greater Nashua area. We've been able to expand to Manchester area, and we're all the way up to Concord right now. So we are hoping to provide all the support, all home care to the people of the state of New Hampshire as best as we can.
Nice,
So, yeah.
nice. So now here's a scenario. Sometimes the family member cannot stay home.
Yes.
And maybe there's a neighbor or maybe there's a friend
Yeah.
that can actually provide these the patient care services. Is that person eligible to participate in this program as well?
Absolutely. If it's a neighbor that always goes to take care of your mom and just to check on her and make sure that she's fine, do some meal prep, we would be able to hire that neighbor to get paid to take care of the mother. Or the grandma or the loved one. So it doesn't have to be completely family.
Right.
It could be friends. It could be neighbors. Someone that you've known for a long, long time that you already consider them as family. This could be anyone that you're taking care of and they're enrolled in the Medicaid. They would be able to participate in the program.
Right.
Yeah.
Now, so I have another question with regards to Medicaid, because that's where the reimbursement comes back for the payment of the
Yes.
services that are provided. If an individual qualifies but is not enrolled in Medicaid yet,
Yeah.
does your program help with that?
So if they're not enrolled in Medicaid, what we do refer them to ServiceLink.
Okay.
So ServiceLink is able to help them get enrolled under Medicaid, under CFI, under all these programs that are covered by the Department of Women and Health Services. So if anyone is like, I don't know what to do, this is my situation, all I would say, just give us a call. We'll be able to direct you to the right person, and we'll be able to follow through and make sure that it actually happens.
Yes.
Yeah.
Now, how long did you work as a patient care assistant or as a home health aide before you made this transition yourself?
It was about 3 years. It was about 3 years I was able to meet different people, meet people from all walks of life, people who they came out of surgery and now they just like, I can't stay home by myself, I need help.
Right.
And I went and took care of them, and the stories that you hear from them, and you just get to learn the life that they've lived and just get to connect to them. And that kind of made me be compassionate and just be like, I want to take care of the elderly. Like, I want to be in the home care industry and just learn more about them. And just,
Right.
it's very exciting and very interesting.
Yeah.
I always say they have the best stories. If you sit with a woman who's 91 years old and they're telling you what happened when she was 20 years old, it's very exciting and just providing that companionship and
Yeah.
personal care if they just need you to hold their hand as they walk to the bathroom. It's the little things that we don't think that matter that
Yeah.
actually do matter.
Right.
And that's one of the things that I got to learn when I was a personal care assistant, and it has really, really helped me grow in the roles that I've taken over since then.
Yes.
Yeah.
Oh, congratulations.
Thank you.
There's one thing that you mentioned that was really important,
Yes.
right? Because, we talk on this show about things that matter in public health.
Yes.
Connectedness matters in public health. Social isolation has been identified as a major issue for teenagers, as
Yeah.
a major issue for our growing aging population
Aging
as
people.
well.
Yes.
This program actually allows for someone to be with them
Yeah.
and provide, even as you said, the minimal services. So talk a little bit more about what does that look like, and what does the life in a day of a patient care assistant look like?
A day in life of a personal care assistant. So you go to a patient's home, and we're doing this right now with a company. We have personal care assistants. We have LNAs, which is licensed nursing assistants. You go out to the patient's home. You meet with them. If it's in the morning, you help them get set up for breakfast. If they're having a shower, you just walk them to the shower. Because some of them, you'll find them in bed and they can't leave by themselves because they're a fall risk.
Right.
And our goal is to make sure that we don't have falls for our patients, because when the aging population, when they fall, it kind of makes them decline. So our goal is to make sure we minimize the falls as much as we can. So helping them get out of bed, go into the shower, just help them take a shower, go back into the living room or the place that they eat their breakfast, make breakfast for them. If there's laundry that needs to be done, do the laundry for them. If it's changing the bed linen, change the bed linen for them. If they need some light housekeeping, we do the light housekeeping as well. If that person is like, hey, would you please play Scrabble with me? Absolutely. That's companionship. We sit there and play Scrabble with them or play cards with them. Whatever they need to be able to get supported or to live comfortably in their own houses. And we do sometimes most of our PCAs, they either stay with the client for 4 hours, some of them it's 6 hours, some of them it's 8 hours. It depends with the needs of that patient. So we have some of them that do 4 hours in the morning with one patient, and they go out to see another patient who needs the care in the afternoon, because everybody is different.
Right.
So when we take up a patient, we know this, like everyone is going to be different. So we develop a care plan. So the nurses, when they're going out to do the admission, they develop the care plan. They're like, okay, this patient needs this thing exactly. And this other patient wants this. So one patient might say, I need help with groceries. The other patient might be like, I need help with range of motion exercises. So they're all different. We always make sure that our aides, they understand that and they're able to take care of that patient the way that they would like to be taken care of.
Okay.
Yeah.
Now, what kind of training is required for the patient care assistant?
Patient care assistant, we do provide training for them as well. So if someone is applying to be a personal care assistant with us, we'll get the application done, and then we'll do the background checks, and then we provide the training. So we have a state mandated 8-hour training. It's called PCSP training. We do that for them, and then afterwards we do have like another 4-hour training that's, it's for us to this is the new hire orientation. So this is what happens. This is like protection from workplace hazards, protecting the elderly from abuse, for them to know that, hey, you're a mandatory reporter. So if you see something that happened with the patient, you have to make a call. You have to report that. And we also do have like the nurses as well, who are very vital in our company, because they're the ones who go out there every month to see, has something changed? Is a patient receiving the services that they would like? Do they need something else? Has something changed? And if something has changed medically, they inform the PCP of that patient right away and the case manager of that patient. So we're always making sure the communication is done, and we have these relationships with all these the PCPs, offices, and the case managers as well.
Yeah.
Yeah.
Well, that's great. So it's good that relationship with the primary care provider is also sustained.
Yes.
Because if anything changes with that individual's health status, they're kept aware of that.
They're kept aware of that.
And I love that, the linking is there as well, right? And so you've got the person that's there seeing this individual.
Yeah.
And it could be daily or sometimes maybe a couple times a week. It's whatever the client wants to have with regards to the services.
Yes, it's whatever the client wants. Some clients, they need to be seen every single day to be helped out of the bed.
Right.
Some of them are able to get themselves out of bed, but then they need laundry done twice a week or thrice a week, or they need a light housekeeping done. So everyone is different, and we try to understand everybody, and we just take care of them the way that they would like to be taken care of.
Yeah, you got to meet people where they are.
You have to meet people where they are. Absolutely.
And it's one of these things, again, because there's an emphasis on, expanding the lifespan. Like, how do we live longer? But how do we live longer? I should say, so how do we live longer, and how do we do that in better health?
In better health,
and this program seems like it could support better health, because there's the nutrition piece in there where the individual, the client, has the opportunity to have someone there to make sure that they have a nutritious meal, or they have a meal period. Right? And even helping with shopping, because you mentioned that as well.
Yeah. Some of them are not able to go shopping for themselves. Yeah. And that's a very great point about the nutrition part of it, because most of the aging population, they have medications that they have to take.
Correct.
And some of the medications have to be taken with a meal or have to be taken before a meal. So our aides will be there to make sure that that regimen is followed, and they have a meal before they take their medications, or they just prepare a meals instead of them having just something that's not nutritious.
Yeah,
So
yeah.
that's one of our goals as well.
Yeah, that's good. I love this program.
It is great.
It is, and I'm glad that it's expanding. So you mentioned that right now you started out in NASHUA, and now
Yes.
you've expanded to what areas in the southern part of the state?
So we're doing Nashua, Milford, Hudson, Londonderry, Manchester. We're all the way up to Ware. We have a patient out in the Ware area, Henniker.
Oh, so that's past the southern part.
Yeah,
Yeah,
so now
nice.
it's gone all the way up.
Yeah.
We're always expanding and always meeting our patients where they are. And I mentioned the patient in Concord. We have a patient all the way out in Concord, and that's for a family caregiver. So we got the referral from the case manager saying, hey, we have a patient out in Concord. That was a new area to us because we were focused on southern New Hampshire. So we were able to go out there, make sure the family caregiver is onboarded with us and the patient is admitted with us, and they're providing the services. And now the family caregiver is getting paid to take care of the mom, which is he needed the money. So being able to provide that support has been really great.
Yes.
Yeah.
Now, Sheila, can you also talk about, so there are people that could be hired to work in these positions, a licensed nursing assistant.
Yes.
And you've got registered nurses, and then there are patient care assistants.
Yep.
For the family member who is going to be taking care of their loved one at home, is there training for them as well?
Yes. The training is there for them as well. They will do the 8-hour PCSP training, which is telling someone, hey, this is how you help someone to, this is the caregiver, duties of an unlicensed caregiver.
Okay.
Home food safety, meal preparation, all of this, nutrition as well. We do have like a nutrition course as well. So they do the 8-hour training, and then they do the new hire training as well, which is 4 hours, and then they do have the support. We always tell them, if you have any question, feel free to reach out to us. If you have any patient care, you're like, I think this has happened to my mom and I think I don't know what to do, would be able to either go out there, like have a nurse go out there and help them and kind of train them how to do it, or my mom is now using a Hoyer lift, how do I do that?
Right.
Would be able to go out there and be like, okay, this is how you use a Hoyer lift, and just be with them there and provide all the support as much as we can.
Yeah. No, and I'm quite sure that families can appreciate that for those who've actually taken, advantage of it. So we're probably going to have to get on the Public Health Matters show.
Yes.
A family member that has been able to take advantage of this program.
Yes.
As a patient, as a patient care assistant.
Absolutely, yes.
I'm just thinking about at home when my husband and I were taking care of our parents. And what we were fortunate enough that we did it in shifts.
Yeah.
Like, because he worked from home, so he was there. And then when he had to go and do something else, then I was there, or we could call. It takes a lot of work to navigate all of that.
It does.
It was hard, and it's 24/7.
It's 24/7.
So it's actually good that your company provides even respite service for some of the caregivers, especially family member caregivers.
Yes. Yeah.
So are there clients that then will have a family caregiver internally, and then also could have a patient care assistant that comes from outside to give that family care member a break?
Yes, absolutely. We have some family caregivers who are like, I would like to just take 1 week of vacation, just go out there, because they're taking care of the parent every single day and every single hour. You said it's 24/7, because if your mom wakes up in the middle of the night, you will be there.
Correct.
To make sure she doesn't fall, or you giving her the help that she needs. So yes, we do have when they ask us for that respite, we're like, how are you feeling? So that they don't get the burnout, because I always say you cannot fill a cup from an empty cup.
Right.
So you always have to fill yourself up. We try to avoid the caregiver burnout as much as we can.
Yes.
Yeah. And in some situations, the family caregivers they say, hey, I do have one of my neighbors, can they just take some hours off of me, and so that I can be able to go out and do something else?
Yeah.
And we're like, absolutely. So we hire that neighbor, and they pick up some hours that, the family caregiver was doing. So it's very flexible, And the hours are flexible. We're not going to tell you, hey, it has to be an 8 to 5 job. No, if you are doing something during the day and you would like to keep doing that, we're like, absolutely, you do that. But if you just have to tell us, hey, these are the hours that I would like to, just clock in and clock out for my mom and just get reimbursed for it. So we're very flexible with the schedules.
Yeah. No, that's awesome. And that support is so needed.
Yeah.
And again, that
needed.
whole connection, and because it helps so much health-wise, mental health-wise, it helps reduce the stress in the home setting as well.
Yeah.
How do you, or how do the workers kind of integrate themselves into that family? Because there has to be that level of trust that's built as well. We actually had home visitors come in, home health aides come in with our parents, my mother and my mother-in-law. And it was one of those things of like, okay, let's get to know who this person is who's now interjected into our home.
Into the family.
Yeah.
Because it's like you're welcoming this person to come in and take care of your mom. So they get to know more about them. Sometimes, the family, they ask, okay, so who's coming to see my mom? What time are they coming? I would like to be there to meet them.
Okay.
And they get to know more about them. And some of them say, hey, I have a notebook that's on the table. Just make sure you document every single thing that you do for my mom.
Right.
And through that, they grow this connection with the parent and with the family as well. We've seen some beautiful memories of beautiful relationships come out of this, where family members are like, oh my goodness, we love this caregiver. They're the best thing that ever, happened to us or come to us. Sometimes you do have family members, they have someone else that they're like, oh, I have this person that I have known for a long time, or I was paying this person privately to take care of my mom, but I can't afford it anymore. So with the program, they get us to hire that person and we pay that person for them.
Okay.
So it's So
you kind of got a lot of things covered.
Yeah.
Yeah.
All the bases are covered.
Nice.
Yeah.
So Sheila, in this last minute, tell us a little bit more about, so what's your vision for how this continues to grow in this area?
My vision is to make sure, especially the minority communities who they have parents at home and they're living with them and they've lived with them for like years, but they are not aware of the program. Or anybody who's out there, they're like, I am taking care of my mom, but it's getting to a point I need to go out and do a job to get reimbursed. My vision for this program is to have anybody across the state taking care of their parent in their own homes, to make sure that they know about the program and they check to see if their parents or grandma is eligible for the program and get enrolled for it, because there's no harm in getting reimbursed to do what you're already doing. Yeah,
exactly.
Yeah.
And that reimbursement or that monetary give back can always be used in that household.
Household.
It just helps people feel even better about the things that they're doing. Gives them some validation for some hard work.
Yes, it gives them the validation. So we do appreciate all the work that family caregivers do to take care of their parents. Just know that you're seen, you're heard, and you're valued.
Awesome. Thank you. Sheila, thank you so much.
Thank you
That's
so
Sheila
much.
Kimani, who is the Director of Business Development at Guardian Home Care of New Hampshire. Thank you for being our guest today.
Thank you. Thank you for having me.
All right. I'm Bobbie Bagley, and I'm reminding you to have a great day today and a better day tomorrow. See you the next time on Public Health Matters.